So is cardiac rehab effective? Yes, absolutely. There are plenty of data to indicate that it is effective. People are going to improve their VO2 max. They're going to be able to work at a higher intensity without developing ischemia. They're going to be able to improve their endurance, so the duration of their exercise. It will help them with their cholesterol levels because, as we know, many people with heart disease are going to have unfavorable cholesterol profiles. And the people with heart disease are also at risk of having another heart attack. So cardiac rehab appears to reduce their chances of having a second heart attack. So they did a study at Duke, and they found that people who attended 36 sessions, this is what Medicare will pay for. So they lowered the risk of heart attack. So the people who completed all the sessions did much better. So they lowered the risk of death in people, so the more the better. This is one of the few cases where the people who attended all the sessions had a much better outcome. Lower risk of death, lower risk of subsequent heart attack, and, so, they had almost a 50% lower risk of death for people who attended all sessions versus those who only attended one. So cardiac rehab, definitely effective. As we mentioned, Medicare will pay for 36 sessions. That's it. And with Medicare, we're talking people who are mostly going to be over 65, unless for some other reason they're on disability and maybe they have Medicare. That's pretty rare, but we're talking people 65 and older. So if you don't have Medicare, then it's really dependent on your insurance. Is your insurance going to pay for you to go if you're a 50-year-old man and you had a heart attack? They may or may not. So, regardless, people are going to get 36 sessions on Medicare, on that outpatient phase 2 program, then they're going to be sent home. And, what is a real problem is less than 20% of people who are eligible for cardiac rehab get referred. And so typically, if you walk into a cardiac rehab session at a hospital or a cardiologist's office, you're probably going to see a group that is, majority white men. Now, of course, we know that doesn't mean, we know women get heart disease. We know non-Caucasians get heart disease in some ways, at least as much as Caucasians, but it tends to be white men who are the most referred. And so it is a problem, and it's frustrating because if we had the ability to offer more cardiac rehab, then we're talking jobs for people with exercise science degrees. National data indicate that for 1 MET increase in your fitness, in your VO2 max, you get a 10% reduction in all-cause of death. So that's a pretty good bang for the buck. So 1 MET for 10% risk reduction of death sounds pretty good. So a little bit of a transition now, going on to emergency procedures. Do you know if you're, especially regardless of whether you're working with high-risk cardiac or pulmonary patients, even with young healthy adults in a fitness setting like the West Center, do you know what to do in case of an emergency? Can you look at risk for liability? If you are really interested in this, I suggest you check out Dr. Schofer's class on PhD 525 risk management. And so that can be taken as an elective by exercise science majors. So, you can really assess that in detail with that class. Where are the risks for liability? You have to be concerned with this, whether you are an employee, whether you're working in a hospital or a clinic or a fitness facility, and especially if you want to be an owner of such a facility. You want to own your own therapy clinic someday. So, where is the risk of liability? What does it have to do with the physical setting? If you're outdoor at a boot camp, their risks are going to be much different than if you're in a hospital where you have a ton of physicians who are going to be within shouting distance. What types of equipments are used? What type of training level? Being prepared for emergency. What do you do? What do you do if someone trips and falls? As we know, there's no such thing as zero risk with exercise, so you have to be careful with, you know, and ready in case something happens. You know, people can faint, people can have heart disease, and keep good documentation and record keeping.